any regrets for getting them in, but I have no regrets getting them out. I would not have been upset if they had just been flat socks. Because I was just so happy to get them out. My rib cage was flattened because of the implants, and this is what was in my body, and it still amazes me. Okay, we are back on the topic of my explant journey when I removed my breast implants just 3 months ago. So I have shared videos about my explant story, why I got them, why I got them out. I shared my journey from surgery to going into recovery, and I talked a little bit about it, but I wanted to just give a full update here in a quick little video. I know this is a very topic-oriented video, that it doesn't pertain to all of my followers on my channel, so I pray this reaches the women that need to hear it, that may be suffering from dealing with problems from their implants, or they maybe never even get the implants if they've been considering it. But all of you that it does not pertain to, that still watch and support my videos, I really appreciate it. I appreciate all the encouraging words I got from all of my beautiful friends I've met here on praying for me during surgery and recovery, and just checking in on how I was doing. It means so much. So if you didn't already hear my story on my implants and getting the explant, I'll link those videos below. There's 2 or 3 of them now. I have a playlist called Explant Journey, something like that, so you can watch them all. This will probably be my last specific video. I'll still probably talk about it here and there, but this will be like the last specific video talking about my explant journey. So let's just talk about the surgery. There were so many obstacles getting to the surgery. It felt like I was never going to get them out. I shared before that I had surgery planned. Found out I was pregnant 5 weeks before the surgery back in 2023. I had my son, who's laying on the floor beside me if you hear a baby talking. I had him and had to wean him to have the surgery. So we'll talk about breastfeeding in a minute too, but there were so many obstacles. And then once we actually got down to the week of surgery, I had the surgeon called me. She had to go out of the country. I had to postpone my surgery 2 days, so they were gonna have to fit me in. I ended up being the 4th surgery that day. They were running behind. I was supposed to go in at 12 noon. I didn't end up having surgery until 4 p.m. that afternoon. So it was a lot of waiting. There was a lot of nerves at that point of, am I ever gonna get these out? Is God trying to tell me something? Is he trying to postpone this surgery because he doesn't want me to have it right now? Is there some kind of obstacle? So there's a lot of prayer. There was a lot of nerves that day of going into it. I was so excited. I wasn't nervous at all. I knew that this was going to help me heal. I was going to feel normal again, but getting there was an obstacle. We had to travel out of state to go to the surgery, and anyways, I had it done. Beautiful surgery. It lasted my surgery lasted an hour and about 35 minutes. There were no complications. She was able to remove the right, I think, completely in block, meaning if you don't know anything about breast implants, a capsule forms around a foreign object in the body, whether it be a breast implant, a splinter, some sort of prosthetic that you have put in your body, root canal. Your body forms a capsule. It's like a barrier to protect your body from that foreign object, because our bodies are so much smarter than we are, and they are always out to protect us from foreign invaders. So a breast implant is a foreign invader. So whenever you have your explant surgery, it is recommended to have the capsule removed, because it has been containing and holding in any and all the toxins, not all of them, but it's trying its best. So that's why when a lot of women have a second surgery and they have their first implant removed, that capsule is opened up, cut open, and a lot of surgeons don't remove that capsule. So it is opened up, things are allowed to expose and leach out into the body, and then a second implant is put in for women that get revision surgeries. And that's when a lot of women start seeing really severe problems from breast implants, is when they have that second one. A lot of women see it with their first set of implants. I saw some minor problems, which I've shared about in past videos. But anyways, that capsule is there to protect us. So it is recommended to remove that from the body, because it shouldn't technically be there. Some surgeons believe that it dissolves on its own, but it does not. So she was able to remove this side with the capsule intact. So she just scalpels or burns away around the implant, around the capsule, and pulled it out all at once. Well, one of them, she couldn't get to the very top, so she had to pull the implant out first, and then she was able to pull out the rest of the capsule. So nonetheless, you want all of the capsule out, either in block or the full capsulectomy if possible, because it's when that capsule is left in the body that women come back several years later and find more and more problems are still arising. They're not healing as they thought they would. So I was blessed to have a wonderful surgeon to get everything out. She showed it all to me at my post appointment and explained to me how everything went. So that went wonderfully. I forgot where I was getting on that, but the surgery lasted about an hour and 40 minutes in all for her to remove both implants, both capsules, and get everything stitched back up. I did not, you okay, buddy? I did not have a lift. I have been asked that question a couple of times. I did not get a lift. Many women do get a lift when they have theirs removed because they are worried about sagging, but I wanted to still breastfeed my current baby, which we are back breastfeeding, and it's not guaranteed that if you have any incisions around the nipple and areola that you can continue breastfeeding. Nonetheless, it would have made it much more difficult recovery to jump back into breastfeeding. So I did not have a lift, and I don't regret not having a lift. The surgery went wonderful. Recovery was a breeze, honestly, because she did not have to cut any muscle. She didn't have to really scalpel any muscle. There was no muscle repair. I was pretty much fine within 2 to 3 days. I was picking up my baby again, and I'd say he was around maybe 12-ish pounds at that time. I was able to pick him up just fine at like day 5. The first, like day 3, I had people hand him to me when I was like sitting down, and I didn't just like deadlift him from the floor or the couch or the bed. I had people hand him to me, but by day 5, I was picking him up. Recovery was a breeze. I know that's not the case for all women. There are different stages of recovery. I will also add that I did not have a full anesthetic, the full anesthesia, like the stronger one, the one that goes in your throat to put you to sleep. I had that when I got the implants in, but when I had them out, I think it's called like twilight anesthesia. It's a very light dose of anesthesia, and I had a nerve block into my back. And I know that sounds scary. If you've had epidurals, I know a lot of women have some numbness in their back from epidurals, and they're kind of nervous about having a nerve block. But this was done by a very skilled anesthesiologist. He was absolutely wonderful. He works with the surgeon I used, and he uses ultrasound to find the exact nerves along your spine, 3 on each side, and does the nerve block before you go back for surgery. So you already start to go a little bit numb before surgery, and then when you get in surgery and he puts you to sleep, you have 2 more injections on the front to nerve block this area. And it also helped with recovery. I was in no pain because that nerve block lasted for about 12 to 24 hours. I'd say closer to 24 after surgery. So the drive home the next day was a breeze. I was just a little bit sore. I remember getting to about the 24-hour mark and lifting my arms to reach for stuff. Was a little bit sore, but that went away within about a day or 2. So the recovery was a breeze, and I would say if you have the option to have a nerve block, go for it, because it is easier than dealing with any side effects of anesthesia. Some women have nausea when they have anesthesia, so if that's an option, I would definitely ask for that if you are looking at Explant. So that was surgery and recovery and healing, and that just was beautiful. I was recording some videos right after that and just kind of updating y'all along the way with recovery, and y'all's comments were so kind and saying that I already looked so happy and joyful and that I was glowing, and I truly do appreciate y'all's kind words there. And I felt so much better almost immediately. I could take a deep breath. Whenever I went to my appointment, talked to my surgeon afterwards, she talked about how the front of my rib cage was compressed in, and that compresses on our lungs and makes it difficult to take a deep breath. This was why I noticed more increased difficulty working out. I was having more trouble getting deep breaths through a workout. I was recovering a lot more slowly back then when I was doing lots of strenuous workouts when I first got the implants, because those implants were putting pressure on the rib cage, on the lungs, our major organs. They're really close to major organs, and she talked about how my rib cage was flattened because of the implants, and now that will slowly go back into place, and that's why some women feel some rib pain after the explant surgery. Thankfully I didn't. Everything has just been wonderful, and I know that's not the case for all women, so don't just expect that it's all gonna be beautiful, but it has been really a breeze for me, and I'm just so glad to have them out. So let's talk a little bit about breastfeeding. So I know there's a lot of women in the Facebook group that I shared in the last video. There's a Facebook group called Explanting or Breast Implant Illness Healing with Nicole. I'll link it below, but a lot of women in that group ask about breastfeeding and breastfeeding after explant, how long you have to wean before having an explant, and if you're a breastfeeding mama, this probably will be a question you would have. If you're not, this will not pertain to you. You can skip on over to this timestamp right here. But I only had to wean for 6 weeks. Now there are surgeons that want you to wean for 3 months to 6 months, just because in the instance that a milk duct does get cut in surgery, because our milk ducts do run, there's like a web of system of veins and ducts that run all across the breast, and if one happens to get cut, although my surgeon was working pretty much in the back, I was behind the muscle with my implant, so the milk ducts were all at the front, so she didn't really think she would hit anything. But in case they do, that can risk an infection. If there's milk starts leaking, that can cause a rise of an infection. So that's why some surgeons want you to be fully weaned and dry for 3 to 6 months. It just depends on the surgeon. But she only requested 6 weeks. This was actually the reason I picked this surgeon. She was very skilled, and she also only requested me to be weaned from breastfeeding for 6 weeks. So that went fine. I didn't have any milk at that time. I weaned him about 8 weeks prior. I have a video talking about what I did for feeding him in that time because he was only 4 months old at that time. Nonetheless, after the explant surgery, I wanted to start relactating almost immediately if I could. So I think I explanted on the Friday. Sunday I relatched him. I didn't get anything obviously, but I relatched him. I used the SNS Supplemental Nursing System feeding tube, and that's what we've been using, and it's helped my milk supply come back, not fully back. We are 3 months out, and I would not say my milk supply is fully back to what it would be. I don't know if it ever will be with this baby, because I did have that weaning phase, and he is getting supplementation, and he is now on solids some, so I don't know if I'll ever get it back. I don't know if I'll ever have the milk supply I was meant to have if I had never gotten implants, because I talked about before, when you put a foreign object in the breast, it stretches and strains those tissues that help with milk supply and milk production, and can just put a strain on producing milk. Some women have no problems with breastfeeding with implants. I was not one of those women. So if that is a concern of yours and you're thinking about implants, maybe think about your future breastfeeding journey and that you don't want to ruin that in any way, and maybe make a different decision. I so wish I had. So we will see if we have more children, if breastfeeding is any different, or if my milk supply is still kind of just lower as it always has been. I pray it's not. But nonetheless, breastfeeding and relactating has been great. I'm not fully back to my full supply, but I am able to latch him. We are using the supplemental nursing system, so he gets the bond of being a breastfeeding baby. He's getting antibodies from the bits of breast milk I am making, and I am able to express milk. So that has been a prayer answered. I prayed so much that I would be able to still breastfeed him afterwards. If not fully my full supply, at least for him to have the bond of breastfeeding and it not to be painful, and it has not been at all. Not even those first couple of days. I just had to make sure he didn't hit incisions or kick or anything, but he was still really young at that age, so he wasn't super wiggly at nursing yet. Now he is, but now everything is healed up and doing well. So let's talk about appearance. So obviously, this is what I look like now. I'm not completely flat, but not near what I had. I think with implants, I was close to a D, probably a double D after having children. When I got the implants, I requested to have a C. That is the size I was, and luckily they did give me the correct size implants. There are women who get requests, like pick out their implants before they go in for surgery and get placed larger implants than they requested. That happens all too often. Mine were a different style. I had requested the teardrop gummy bear, which that means they're shaped kind of like a raindrop or a teardrop. It kind of helps look more natural. And I also requested the gummy bear, which are very cohesive and jelly, which I'm actually thankful I didn't get those, because those are the ones that are very associated with the breast cancer associated with breast implants. But nonetheless, I was given the wrong style implants. I was actually given a cheaper version of implants, probably just because they were cheaper. I was charged for the more expensive style, but I was put in my body a cheaper version. So I was given a silicone round instead of a gummy bear teardrop, which, I mean, this is what they look like. They are round. Now, when they're in the body, they do sort of hang more like a teardrop, but nonetheless, they are round. They're not teardropped. They are silicone, but I guess it was kind of a blessing because these were not the ones as highly associated with that form of breast cancer. All implants can be associated with cancer because it is a risk we take when we put that in our bodies, but thankfully, I guess sort of a blessing in disguise, I was given a different style than I requested, the teardrop gummy bear. So this is what was in my body, and it still amazes me. So as far as now, with the implants, I was a C before children, D or double D after children. Now I have not been fitted for a bra. I don't care to be. I'm usually just wearing nursing bras or like fitted tanks as far as bras, but I would say I'm a larger B, smaller C now. As far as like sagginess, if you're wondering about that, they're not as perky as they would have been before children, obviously, and definitely I am larger than I was before I had children because I have gained weight. I have breastfed children. Breast tissue increases usually when that happens. I am still breastfeeding a child, so when I'm completely not breastfeeding, we'll see what changes, but I'm not in any way or form disappointed or upset with how they look. I would not have been upset if they had just been flat socks, because I was just so happy to get them out. My husband and I joked that I was just gonna have flat pancake socks on my chest once I got them out, but that has not been the case. You would be amazed at how well your body can recover from trauma, how well it can heal when you're healing it properly. Just the amount of bone broth and collagen and gelatin that we consume in our family, I think in itself helps with recovery. It's helped with scarring. So they are a little bit flat still on the side. They call it fluffing. If you know much about the breast implant world, the ladies will call it fluffing. So for the next year, your breasts will kind of fluff back up to their natural state. So they're definitely smaller. They are definitely a little bit saggier, but they're not near as bad as I expected. I really did expect worse than I saw, and I was pleasantly surprised with what I saw. So I would just encourage you, if that is a fear of yours of how they will look, maybe you were completely flat chested, a larger A, smaller B when I got the implants. So the main reason I got them was they were not symmetrical. That was the main reason I got them. I had one smaller, and I still have one smaller. This is getting very personal here, but I'm trying to be real with y'all and give you encouragement for those women who may be facing those same fears as I did. So if that is your fear of how they look, or if you will be flat again, just more so look at the health benefits of getting them out, and then just give your body love and grace for how it was created, how God created our bodies. That's how He wanted them to look, and I truly regret every ounce of the decision I made to alter my body from what He made. So that is appearance. What else did I want to talk about? I didn't take notes for this video because I just wanted to share from my heart, to share about recovery, give encouragement for women who are considering implants, hopefully to change their mind about getting them, or women that are considering explanting. Just give you some encouragement in that journey, and that you can do it. It's not near. The hardest part is actually making the phone call and booking the surgery. The actual surgery and the recovery was not near as hard as I expected, nor was the results that I got, and I did not get a lift. Women that get a lift probably have even more fantastic results, and I've seen many women in the group that are well pleased with their results of the lift, but that was just not something I wanted this time in my life. I didn't want any extra cutting or scarring on the already trauma I'd placed to my body, so that was just personal preference. But I'm very well happy with the results, very well happy with the healing. So let's talk a little bit about healing, what I've noticed changes in. So I shared in that first video, I think it's called Health Over Vanity. I'll link it below if you haven't seen it, but I shared the symptoms I had, and my main ones were a patch of eczema right here on my chest, fatigue, joint pain, really all the issues that are related with the gut issues. My gut was wrecked just completely, which a lot of Americans are, just from the diets that we eat, the overload of toxins we have in our environment. But even more so, women who have breast implants almost always have gut issues. So I had a very rough patch of eczema right here. The roughness was gone within about 3 to 4 days. There was still a little bit of a visible appearance of it, but it was smooth, like just skin again. It wasn't rough and scaly anymore. And then within about a month or two, I'd say, it's completely gone. You can't even see it anymore. So that was a blessing. It wasn't anything like a big deal, but it was just this little patch that I could see. You couldn't see it in like shirts because it was lower on my chest, but it was crazy how that was related to the implant. Another thing I talked about was my feet. My feet were atrocious. No matter how much I soaked them in salts and put lotions on them, healing lotions, coconut oil, they were always dry and cracked. And that is also related to gut health and healing of the gut, thyroid issues. They have cleared up drastically. I have noticed my skin feels clearer, my eyes feel brighter. Many of y'all kindly told me that I looked like I was glowing, and I don't know if I actually have seen that, but I just have felt that my skin feels clearer and smoother. Just all these things that our body is no longer in fight or flight mode when we have implants. I'm just gonna talk to him because he wants me to talk to him. When we have implants, our body is constantly like in a fight mode, so it's not able to do its normal tasks as effectively. Weight gain, I have, I'm not like tracking my weight or anything, but I have noticed that clothes fit better already. I have done a lot of changes in our diet as far as modern wheat. I've shared about that, so I know that has helped in also regulating my weight, but also in healing the gut. So all of the things that I had wanted and prayed that would heal, most of them have. What else? I did have some numbness in my fingers. I don't know if I actually mentioned that, but that was potentially due to a pinched nerve being, a nerve being pinched by the implant, causing some numbness in my fingers. That is completely gone. And that was just kind of an annoyance. Not that it caused inability to move my fingers, but if you have any numbness in your body, that's just kind of an annoying, frustrating problem. And I will never say that the problems I had from my implants were near as bad or severe as some women have. Some women are bedridden due to their implants and get them out and are a completely new woman. I'm so blessed that I did not have such severe effects from my implants, but I know there are women that are, and my heart truly goes out to you, because the small things I did notice were just annoying and difficult to handle and frustrating, knowing that my body was not in the state that it needed to be. So my body is continually healing. It takes, I mean, I had the implants for 7 years. I'm not going to heal completely in 3 months. So I am excited for continued healing over this next year, up to 2, 3, 4 years. It's kind of like I've had the implants for 7 years. I shouldn't expect my body to completely heal within 7 days or even 7 months. My body's been under a lot of stress and it has bounced back wonderfully, but I know there's more healing to come. There will be more things to change. There will be more improvements, and I'm just really excited with what's happened so far, the changes I've seen. And just for my daughters, them knowing now that I don't have a foreign object in my body. And I've seen this question before of women that I have in the Facebook group that I keep referring to, asked, how did you explain to your children your surgery? And there were some women that said they told their children they were just going in to have their chest looked at. They didn't actually tell them. But I found that telling my children the truth and being completely transparent and completely honest about my surgery and letting them know that mama made a mistake and that this is a regret I have and this is why we don't need to alter our bodies from how God made them, they understood it very wonderfully. They understood it completely. They prayed with me about it before surgery. They prayed with me about it after and thanked God for letting me have a safe surgery and for healing that has come. And they were able to understand it so well. So if that's a question you have of what do you tell your children, I mean, I guess depending on their age, if you have teenagers or like 8, 9, 10-year-olds, mine are 5 and under, they understood beautifully. I just told them the truth that mama had implants put in her body, this horribly toxic filled bag put into my body to alter my appearance, because I did not like how God made me and that was very sinful and very wrong of me, and that is something I've had to ask forgiveness for, and that I was having these removed, and that they would cut me open and I showed them the scars, and they understood so well. It's amazing what our children understand when we just explain things to them like they're capable of understanding things. So that is kind of how I've handled it with my children. After surgery, I was able to hug them, and it was so wonderful to not feel a foreign object between them and my husband. Breastfeeding, like I said, with my infant has been wonderful. Anything I left out that you have specific questions about, leave them down below, or you can always email me. I'm happy to chat through email. I've had many people reach out to me for specific questions on birth and breastfeeding and any specific topic that you don't want to write below. You can always send me an email and I'm happy to go more thoroughly in depth. I don't want to leave it on a public YouTube video. So let me know if you have any other questions. I am so excited to be on the other side of having implants. A big regret, but I know that God lets us go through trials, and everything we go through is to glorify Him. I pray that this story, this trial, this challenge that I did to myself 7.5 years ago now will glorify Him and help another woman to never get implants or to get hers out and recover as I have been recovering, and just pray that this video blesses someone. Again, I thank all of you ladies who don't have implants and you've shared this with women who do, or women who have been on a similar journey as I have with seeing problems with their implants and considering getting them out. Many regrets for getting them in, but I have no regrets getting them out and would just never wish this on any woman. Hope that women seeing this will make a better decision than I did, or at least explant as soon as they are seeing problems arise, so that more serious problems don't start to arise. So talk to y'all next week, back to our regular homemaking and motherhood content.